Carmen Camelio, President of RUNAP. I've worked at RGH for over 20 years, and I'm currently part of the Rapid Response Team. I previously worked at MICU, and it's been great to have the opportunity to work with nurses and bedside providers across the hospital in my new role. RUNAP advocated for the creation of the Rapid Response Team during contract negotiations, and it's one way that we've been able to work together to implement positive changes to our workflow. Our first union contract laid the foundation for necessary and meaningful changes, including a transparent wage scale based on years of licensure and annual pay increases. As healthcare becomes increasingly profit-driven, the collective voice of bedside providers is more vital than ever. Our contract sets the standards for management to follow, and it's up to each of us to ensure that it is respected and enforced. By standing together, we've seen tangible changes to working conditions, including, through the grievance process, RNs have received over $70,000 in back pay to correct errors in the wage scale and certification pay. Over 50 members have invoked their right to a union representative during an investigatory interview with management. Successful reduction of unjust discipline, including over 100 instances of discipline for attendance. These changes are all the product of our resolve to stand together and advocate for safe working conditions and quality patient care. The more people who are involved, the more change we can affect. If you believe that the contract has been violated, we encourage you to file a grievance. If you are afraid to file a grievance or take action because of management retaliation, the full force of RUNAP will stand with you. It is our right and our duty to advocate for change. We were very excited to see that the healthcare workers at Kaleida and Buffalo reached a new contract recently. That agreement was reached at 4 a.m., just hours before a planned strike vote. It included increases in differentials, including preceptor pay at $3.25 an hour and charge pay at $3 an hour. We know that a strike is our strongest tool. Though it seems like it is far away, our contract expires in April 2027. We will be beginning to prepare for bargaining next year. The way we avoid a strike after our contract expires is to continue to show unity and resolve over the next year so that we arrive at the bargaining table with momentum and clear priorities. While we always hope to avoid a strike, we recommend starting to save now in the event that we vote to strike. We all have to decide whether the status quo is acceptable. If it's not, we must take action. Just recently, we filed the notice for the second quarter financial penalty, and will be releasing the information publicly to continue alerting the public to the dangerous conditions within the hospital. We worked collaboratively with the hospital for over a year to attempt to mitigate the staffing crisis, but without pressure, we don't expect system-wide leadership to take meaningful action. Since filing for the first quarter financial penalty and making those numbers public, we've seen improvements in staffing on many floors. We're making progress, and the more people who fill out unsafe staffing forms and file grievances, the more we show management that we expect fairness and safety at work. While we've seen staffing improvements, that has not been distributed evenly across the hospital. The emergency department remains chronically short-staffed, which puts staff and patients in harm's way on a daily basis. When the floors are understaffed and they close beds, that backs up to the ED, which lacks the support to sufficiently cover critical patients and community needs. What impacts one unit can impact all of us. The more RNs stand together to demand safe staffing and an end to the culture of bullying and retaliation, the more change we can make. If you receive any pushback or retaliation for taking action to address staffing or injustice at work, know that your union colleagues stand with you. We are here to advocate for our working conditions, our profession, our patients, and our community. You are not alone. I urge each of you to take action and reach out for support if you face any kind of retaliation. We are stronger together.